Dr. Chang-Gu Han will talk about excess mortality and disease incidents following tropical cyclones in Korea. Welcome. Thank you.
Hello, my name is Chang-Gu Han, and thank you for this wonderful opportunity for presentation today. My talk is about the changes in mortality after tropical cyclone exposure in Korea. So tropical cyclones are major natural disasters which cause significant loss of life and property damage. By looking to the future, impact of the tropical cyclone will continue to increase due to climate change. With the 2 degrees of Celsius increase in global ambient temperature, the global intensity of cyclones and also related precipitation will increase. Korea is affected by 1 to 2 rainfall tropical cyclones per year, and the average annual damage by tropical cyclones were $75 million for the last 10 years, and it was increased from 1.2 million in 2013 to 182 million in 2022. The government is reporting a total of 78 direct deaths from cyclone-related injuries from year 2006 to 2022. However, tropical cyclone exposure not only increased the injury related to direct deaths, but also additional death from other causes. And these increases might be attributable to hidden stresses and disruption of the normal medical service use during and after the tropical cyclone exposure. However, most of the studies dealing with the mortality effect of the tropical cyclones are concentrated in Northern America. So despite the fact that Asia is routinely affected by the strong typhoon events, the relevant evidence in this area is relatively limited. So aim of this study is to evaluate the mortality burden due to tropical cyclone exposure in Korea. Korea Meteorological Administration provides data of tropical cyclone which affected Korea since year 2002. The data includes occurrence, dissipation, and meteorological observations recorded in 3 hours interval. The observation includes central position, central pressure, trajectories, maximum wind speed, and most importantly for this study, the gale radius, which means the area exposed to the wind speed over 50 meters per second. So by referring to the previous literatures, we defined wind exposure was used to define the exposed areas. So cyclone exposed region in this study was the regions falling within the gale force wind radius during the movement of the cyclone. And in contrast, control regions were regions located outside of 1.1 times the gale radius, and regions never included in gale radius during the cyclone movement. And the special resolution of this regional classification was basic administrative units of Korea, which is also called 시군구. So Korea has 250 basic administrative units, and mortality data was archived in same special resolutions. Mortality data of Korea has unique aspects. It contains age of death and residential address and education levels of disease and location of the death, whether people died inside or outside the medical facilities, and cause of death for several cause-specific diseases. I'd like to highlight the one aspect of the tropical cyclone is about its random nature. The timing, intensity, and trajectories of tropical cyclones are largely unpredictable. So I believe exposure to cyclone can be considered as if random, and because of that, the exposure to cyclone might be independent of the health outcomes in each region. So based on that, we can leverage this randomness to conduct good quasi-experimental studies. And among the diverse methods, the generalized synthetic control method were used for this study is a flexible data adaptive method which can be applied to the time series data. So it actually generates the single synthetic control which tries to mimic the time series of the treated before the treatment. And if the, So if the time series pattern of the synthetic control and treated are comparable before the treatment, the difference in time series of synthetic control and treated after the treatment can be interpreted as a treatment effect. So we set 30 days prior to the cyclone exposure as pre-treatment period, and post-treatment period was defined as 2 weeks after the cyclone exposure. The mortality series of each cyclone exposed region was compared to that of the synthetic control, and we calculate the daily average increase of mortality across exposed region for 2 weeks after the cyclone exposure for each cyclone, and we meta-analyzed the effect estimates. However, to apply the generalized synthetic control method, we need a clear, distinct classification of cyclone-exposed region and cyclone-unexposed region. So, among the 21 cyclones which affected Korea from 2002 to 2023, we selected 9 cyclones which partially affected Korea and excluded 12 cyclones which swept across the entire Korean peninsula or which showed the only dissipated pattern after the landfall. We added some sensitivity and stratification analysis to increase the validity of the study and to depict the vulnerable population. So we first assumed that the area close to the cyclone center may experience more effect. So we defined the area within the half of the gale radius as the severely exposed regions and compared with the pre-selected control regions with the expectation that the effect size might be more higher than that of the main analysis. So left is showing the control region and cyclone exposed region, and right is showing the control region and severely cyclone affected regions. Second, we conducted the age group specific analysis, and we also used the education levels as the surrogate marker for socioeconomic status and conducted education level specific analysis. And we also assumed that the severe injuries or health risk would result in death outside of medical institution, so we conducted location of death specific analysis. We also conducted several negative control analysis. We assumed that there should be no difference in mortality after an artificial time point irrelevant to cyclone exposure. So we selected 2 time points, 1 year before and 15 days before each actual cyclone exposure, and conducted the identical analysis with the expectation of the no result. So this is the overall flow. So we selected tropical cyclones which partially affected Korea, and we archived the mortality data, and we run a generalized synthetic control analysis and calculate the average change in number of daily mortality during 2 weeks after cyclone exposure. And we meta-analyze the effect estimates and conduct several stratification and sensitivity analysis. So there was a significant increase in the all-cause mortality after the tropical cyclone exposure in the exposed region. So there was 0.02 during the 2 weeks after the cyclone exposure, there was a daily average increase of 0.09% of all-cause mortality in each cyclone exposed region. Well, 0.09 seems very small, but because it's 2 weeks, we have to times 14, and because we have to times all the number of the exposed region, and we can get the decent number of the all-cause mortality burden. There was no changes in the infectious disease mortality, and also the cancer mortality and endocrine disease mortalities. There was no change in psychological disease mortality, and there was marginally increasing cardiovascular disease mortality. There was no changes in respiratory disease mortality, gastrointestinal mortality. There was a marginal increase in external injury mortality and significant increase for the non-accidental disease mortality. This first plot shows the result comparing the severely exposed region and synthetic control. And as expected, the effect size for all-cause mortality, external injury mortality, and also the non-accidental disease mortality was larger than that of main analysis. So this is the main result. So there was a significant increase after the tropical cyclone exposure for the all-cause and non-accidental disease mortalities, and also a marginally significant increase for the severely affected region for external disease mortality. So we applied the result of the meta-analysis to each of the cyclones to calculate the mortality burden due to cyclone exposure. So on average, there was around 150 mortalities after each cyclone exposure. This figure shows the stratification results, and generally there was an larger increase of risk in the older age groups and also the low education level groups. And this result shows the result of the negative control analysis, and as expected, there was no association So to wrap it up, this study evaluated the changes in mortality after 9 tropical cyclones that partially affected South Korea from 2007 to 2022. On average, total 150 excess deaths occurred within 2 weeks after each cyclone exposure. And we are currently doing with some additional analysis with using the health insurance data because we have a unique health insurance system covering the older population of the entire Koreans. So by using the nationwide compulsory health insurance system, we are now doing some analysis for the number of hospital visits and number of emergency department visits, and also number of new disease incidents after the tropical cyclone exposure. There might be numerous limitations for this study, and first of all, there could be an exposure misclassification. Also, we use the Gale radius as radius to classify the exposed and non-exposed region. There could be an exposure misclassification, and other potential time-varying covariates were not included in this study, such as ambient temperature. And also the other factors which may affect the validity of the cost-experimental design could be a significant limitation of this study. Well, this is all I prepared, and thank you very much.
Thank you for the presentation. We have actually a lot of time for questions, so any questions? Yes, thank you. And please state your name and if you want your affiliation before asking the question. Thank you.
Okay, sure. Thank you for the great talk and really interesting methods. Thank you for explaining as well. Melissa Pfeiffer, and I'm at University of Illinois, Chicago. And I was wondering how you selected the 2 weeks follow-up after the storm exposure, thinking about the different types of mortality and the findings maybe being smaller for some of the chronic disease-related mortality, like cardiovascular disease. Could there be like a longer follow-up period that might pick up some of those, the mechanisms might be different than the direct damage, for example?
Yeah, thank you for the very nice question. And I mean, for the selecting of the 2 weeks, I just refer to the recent publication which evaluate for the 2 weeks. And but I really agree with your point because the mortality, I mean, injury-related mortality really occurred right after the cyclone exposure. So if we limit the post-treatment period to 1 week, I think we'll probably see the significant result. And as you told, if we widen the evaluation period, we could somehow catch some other significant mortality increase after the tropical cyclone exposure. And thank you very much for your very nice comments. Thank you.
Josiah, please.
Hi, I'm Josiah Kephart from Drexel University. Thanks very much, and really cool design. I thought that your definition of exposed versus not exposed was very reasonable, but I'm wondering if you thought about kind of playing with that buffer a little bit. I think you had 1.1 times outside of the affected area, just to see if you might see a different impact with some of the cause specifics.
Yeah, thank you for the very nice comment, and yeah, I will definitely do it by setting the other, buffer range to define the cyclone exposed and unexposed regions, and to see whether we can get, consistent results. Thank you.
Okay. Thank you.
Thank you.